The radiation itself, I didn't feel any pain. It was just keeping still on the bed, and you have this big machine going around you, and you have to keep still. You can't cough.
You walk into a room and there's two big double doors, and you walk through one set of doors and another set of doors, and they come and they set you up on the table, and then they all quickly vanish, and you hear all these double doors close. You think, this is wrong too, what you're doing with all the radiation and so forth.
I think I found the radiation harder than the chemo, because the radiation, you can't see what's happening to you while you're going through it, whereas the chemo, you have a cycle. You have a chemo, you have a recovery in between each cycle, and you have a week of it happening to you, a week feeling lousy, and then you start feeling better. Radiation is every day. You go up to the hospital every day for an invisible thing that's been given to you. I would advise anyone to book yourself some time after the radiation, just to have some chill out time from work, just because you are pretty tired, yeah.
The tiredness and things, kind of gets to me quite a lot, because I've always been quite a person that will, go at 100 miles an hour kind of thing, and try to fit in as much as I could in one day.
Fatigue is quite a difficult side effect to manage, and we're not particularly good at managing it in the medical profession. I think the women should try and do as much as they feel like doing, but if they do need a rest, then they should listen to their bodies and rest. And it is a very individual side effect, so some women will be more badly affected than others.
We travelled to Hamilton. I say we because I had so many different people take me. We travelled every day. We had the opportunity of staying in the lodge, which would have been really lovely, but because Luke was only 3 years old, being away, for nights on end every week for 6 weeks just wasn't, and I would have missed him. I couldn't have coped with that either, so we chose to travel.
There is no way I want to stay at a cancer lodge, even with a name. And I went over and I just saw all these old people there, and I said to my husband, there is no way I'm staying at that place. It would just depress the hell out of me. I'm just not going there. So when I turned up for my first appointment, I said to the lady at the desk, I don't think I'm going to stay here, but I'll come and have my radiotherapy. And she said, that's fine. So I made my way to my room, unpacked, went to sleep, had the best night's sleep in sort of ages, and woke up next day with a completely different attitude. And I spent a really happy 6 weeks there. It was a really good headspace for me. And it was because of the humility of being amongst people who were really unwell, and we were all on the same page. So you didn't have to tell people how you were feeling. We all had cancer. We all knew how we were feeling.
I think because it was always the same time and every day for 5 weeks, you made a lot of friends.
But it's just every day, and you've got that commitment, it's the same old routine. You walk in the door, you get your smock, you go in, and it's just, I found that really hard. And I got quite badly burnt too.
Peeling, like a really bad sunburn really, but a bit more extreme than that. For weeks afterwards too, once you finish the radiation treatment, it takes almost another good, probably month to 6 weeks that you're still actually burning and having results from that.
I actually really liked radiation. Apart from the pain from the burns once they sort of started rubbing and things like that, compared to chemo, I actually found radiation really easy. I actually really liked the fact that, to start with, I could actually drive myself into radiation and home again, because I just needed to regain that sort of sense of independence.
I was lucky. I didn't feel the burning sensation at all people were getting. That some people that I knew were having problems. It was just, I just noticed the discoloration. It's just a slight discoloration. It was like, one's darker browner than the other one.
Oh, I was fine. It did nothing to me. I never got burnt or anything.
I was told to, keep my body moistened, and they did supply me with some cream to rub on and so forth, but still got really burnt. So they dressed it and so forth and helped me look after it.
There have been a lot of developments in radiation therapy over the last few years. One of the things that we're now increasingly doing is using 3D planning to treat women with breast cancer, so we've got a lot more accurate in our treatment delivery. We can minimise dose to the other structures such as the lung and to the heart. There are also newer techniques coming in, such as brachytherapy, which is using either needles that go under the skin of the breast to deliver a more localised dose of radiation, or a catheter with an inflatable balloon which delivers a dose of local radiation may also be used. These are quite new techniques that are not certainly standard in New Zealand as yet, but may well become so over the next few years.